Welcome to the dental extraction video. If you're watching this video, it means that your pet may need to have some teeth extracted. It's very difficult for us to know if they are going to need an extraction until the day of the procedure, meaning we need to look at dental x-rays and look at the oral exam findings to make a final decision. So it's impossible to know until they're under anesthesia. The decision making for extraction typically involves either tooth mobility, so if the tooth is wiggly in its socket, it needs to go. If on x-ray we see evidence of an abscess and it's infected, the tooth needs to go. If on x-ray we find that the jawbone, which should go all the way up to where the gingiva is, has receded away from really bad dental disease and more than 50% of that root is not covered by jawbone anymore, the tooth needs to come out. Lastly, on oral exam, if there's fractures of the teeth where the inside of the tooth or the pulp is exposed, or if we probe under the gum line and there's a big pocket, those are all indications to remove teeth. Removing teeth or teeth extractions is a surgical procedure. We usually start with a local anesthetic block, just like at the dentist. So we put local freezing agent into their mouth, so that will help keep them comfortable during surgery and then also after. Once that's been put in, then we make an incision in the gum and create a flap so the gingiva is lifted away off of the bone, and we use drills to cut the teeth into sections to be able to pull them out. Once the tooth is out, we usually flush with an antiseptic, oral antiseptic solution, and then we close the gingiva. So we use teeny tiny suture that's absorbable and close the surgical site. After we've done an extraction, we always take an x-ray to make sure that we got all parts of the teeth. We do not want to leave any bits left. If you leave a little piece of tooth, it can lead to infection or problems later on. So once we've taken the x-ray and we've seen that the root and all pieces of the teeth have been removed successfully, then we're all done. That's basically it for a dental extraction. Recovery time for an extraction is about 7 days. We ask that you try to feed soft food to your pet during that recovery time. Just the hard kibble can disrupt the sutures, the really delicate sutures in their mouth, okay? So make sure you do soft food for 7 days. Also, some of our pets will go home with a cone collar to prevent them from rubbing at their mouths as well. At the end of 7 days, please bring them back for a recheck exam just to make sure that everything has healed up nicely.